afternoon?
I'm doing great, thanks. How are you?
I'm well, thank you. Thank you for making a couple of minutes available for me.
Yes, my pleasure.
Are you in Edmonton now, or are you in Toronto?
I am actually in Calgary. I'll be leaving for Edmonton later on this afternoon.
Okay. Well, I hope you brought your scarf, because the roads aren't very good, and it's snowing in the capital region at this hour, so I hope you can travel safe.
Thank you very much. I appreciate it.
I do a piece for the Corus Talk radio stations in Calgary and in Edmonton, which is why I wanted something on this particular event.
Yes.
So if I may, let me roll some tape, start with Good Morning to get us in the right time frame for a morning show piece, and we'll talk
Sure.
a little bit about the message you're bringing to the Edmonton region.
Sure, sounds great.
All right? Here we go. Dr. Ahmed, good morning.
Good morning.
What is the message you are presenting at this education symposium in Edmonton?
Well, it's very exciting to be able to talk about medical cannabis as a viable treatment for arthritis at the Canadian Arthritis Society Symposium. And I will be presenting the evidence that I have in my practice, as well as what other Canadians are experiencing when it comes to using cannabis as a treatment.
How long have you prescribed cannabis for patients?
I've been a cannabinoid medicine specialist for the last 4 years. My background is anesthesiology and interventional chronic pain, and my personal choice to use cannabis as a treatment has really enhanced my practice and really improved the quality of life of my practice's patients.
Talk to us a little bit about how you use it, how your patients respond to it, and whether or not they raised their eyebrows when you suggested that this might be an option in dealing with pain.
Absolutely. So the challenge here is that most of the evidence around chronic pain has been misunderstood due to the fact that we're waiting for large-scale studies to prove to us that cannabis is superior to a placebo. And the fact is, there's lots of research to actually prove this. In fact, there was a double-blind, randomized, placebo-controlled study done, and the results of this developed that THC and CBD in combination had a very efficacious relief for pain in patients that had advanced cancer pain, and were not getting fully managed by strong opioids. And to follow up with this study, there was a study just published in the Journal of Pain in 2018, and now we're discussing how to dose the patients. And so based on this information and plenitude of other research, I incorporate medical cannabis as a choice for my patients to manage their inflammation during the day by using CBD, as well as incorporating THC at night to help improve their quality of sleep, but also to reduce their nocturnal pain. And I've been very fortunate to be part of a technological startup called Strainprint. And Strainprint is a leading mobile app that you can download onto your phone to track your medical cannabis use. And our findings right now are that the top symptoms amongst our app users 65 and older is that they're treating joint pain, insomnia, stress, and anxiety. And in my particular practice, 40% of my patients are using CBD, and this is the change that everyone needs to recognize, that cannabis is not all about THC to be getting high. That's not the intention of the medical cannabis user. In fact, my patient population ranges between the ages of 18 to 68 plus, and I'm treating a variety of conditions because our endocannabinoid system actually is there to help us relax, help us sleep, help us eat, and help us protect ourselves and forget bad things. And it's great to finally be able to use this plant in its best capacity.
I would argue that you are doing some valuable research in the course of running your practice. I hope you're tracking that and will be able to provide it for further study.
You know, that's absolutely correct. And the fact of the matter is, the work that I have been doing here in Alberta, I was having to do quite discreetly due to the fact that this was not legalized. So I've been very pleased with legalization here in Canada, because finally, as a scientist and as a researcher and as a clinician who wants to improve the quality of life of Albertans, I'm finally in a position to do research and actually have funding for research due to the fact that it's now legal. And I'm excited for Canada and the direction that we're going when it comes to the benefits of this plant as a medicine.
I take it that one of the challenges has to do with dosages and frequency of consumption. Can you talk about that? I mean, is there much you've been able to learn from the research that's been done to this point, or is it a case of try it and see if it works, and if not, change something?
Well, the key thing here is that dosing still does remain very highly individualized, and you always need to start with a low dose and go slowly. And that's because THC has a unique effect of having a biphasic response, and we're still, as medical professionals, understanding this better. But what that means is at a lower dose, it has a different effect. At a higher dose, it has a different effect. And you do need a physician to be able to help monitor this, because in instances where the elderly are experiencing heart disease issues, if you were to give them too much THC, it has a rapid effect of increasing the heart rate and relaxing the vessels, which would drop your blood pressure. And if you have heart disease and you're, thinking of taking some cannabis without any guidance, you're at risk of causing more harm to yourself. And this is the direction of conversation that medical professionals need to be following, because the medicine itself is very useful, but we still haven't understood how to manage the side effects. To answer your question, in my personal practice, what I have discovered is that if I incorporate CBD at 2 or 3 times the dose in comparison to THC, I can mitigate or reduce or reduce completely the side effects of THC, which are lightheadedness, dizziness, blurry vision, and a change in time and space, which we call psychomotor slowing. And oftentimes, people who experience anxiety can get great benefit from using CBD up to 25 milligrams a day. And the key thing here is identifying doses, but if you start low and go slow and have guidance around it, you can safely use CBD and THC, much safer than opioids, because there's no death associated with cannabis or any cannabinoids, because we don't have receptors on our brainstem. We can't die of respiratory depression, whereas codeine, opioids, oxy, Tylenol 4s, all of these medications have a combination of some sort of opioid in them, which do bind to the brainstem and cause respiratory depression. So in the case of cannabis, you can start this medication in a safe manner, under guidance, get the benefits of it, but never worry about withdrawal or ever worry about deadly side effects. And that for me is very refreshing and very comforting, and allows me to grow this practice without worrying about negative side effects.
That's terrific. Safe trip to Edmonton, and a strong presentation for the symposium Saturday. Thank you.
You're most welcome. And for the listeners, if they wanted to know, the symposium is sold out currently. However, there's going to be a webcast available on the Arthritis Society's YouTube channel as of Thursday, November 8th. And I look forward to seeing everyone in Edmonton. Thank you so much for having me on the show.
That's terrific. The one thing I wanted to ask before we just ran out of time, do you have any experience with addiction, or is that something that you're able to watch because you are, going low and slow in terms of dosages?
I'm able to watch because I'm going low and slow, but the research proves that the rate of addiction with cannabis is less than 10% for continuous use over 10 years. So in comparison to all other medications, the risk of addiction is very low. But the person who is at risk of addiction itself, that's a different story. And that's where I require my psychiatrist colleagues and other colleagues to be part of my practice to ensure that we're taking care of people.
Yeah, good for you.
Thank you
very much for your time today. I appreciate it.
My pleasure. Thank you so much. Have a great day.
Is there any way to watch this or see it live?
I'm not quite sure. I believe that's the intention, but the Canadian Arthritis Society has a website link, I believe.
Yeah, I'll find out.
Yeah.
I have a colleague here or a friend that I can call and see.
Perfect.
This was really helpful. You travel safe this afternoon, and thank you for making time available.
I appreciate it. And I just wanted to clarify so that I could let some of my patients know, what time will this be airing tomorrow?
That's a good question. I haven't done a lineup yet. I am still collecting information. So it will be between 7 and 9 a.m. on here in Calgary. You're based in Calgary, are you?
I'm based in Calgary, yes.
That's why I wondered with the 416 area code on your cell.
I'm back and forth between Ontario and Alberta. I've got 2 practices. I'm a busy person.
You are a busy person. It'll be between, let me think here. I'll try and put it in the 8 o'clock hour. Let's do that.
Okay.
Just so that, a lot of people are up at that time.
Yeah, that would be great.
That would be the best I could do at this point because it's still pretty early in the process for me.
I understand, sir. And just to remind myself, because I'm unfamiliar, what was the station frequency on the radio?
770 CHQR.
Perfect. Excellent. I'm going to put a post out on Twitter for this. So I just wanted to make sure I knew.
Perfect.
Awesome.
Thank you for this.
Thanks. Bye-bye.
Take care. Bye-bye.
Bye-bye.